Can sleep apnea treatment improve cardiovascular health in COPD? Have you ever wondered how sleep apnea might affect heart health, especially for those with chronic obstructive pulmonary disease? This is a critical question, as both conditions can create a challenging health scenario. When sleep apnea and chronic obstructive pulmonary disease coexist, they form what is known as overlap syndrome. This combination can significantly increase cardiovascular risks due to their effects on breathing and oxygen levels. Sleep apnea is marked by repeated interruptions in breathing during sleep. These interruptions can lead to drops in oxygen levels, putting extra strain on the heart and blood vessels. For individuals with chronic obstructive pulmonary disease who already struggle with lung function, untreated sleep apnea can worsen oxygen desaturation and cardiovascular stress. One of the most effective treatments for sleep apnea is continuous positive airway pressure therapy. This therapy helps keep the airway open during sleep, stabilizing oxygen levels and reducing the number of breathing interruptions. Research shows that using continuous positive airway pressure therapy can lead to better cardiovascular health outcomes, particularly for patients with chronic obstructive pulmonary disease. For instance, studies indicate that continuous positive airway pressure therapy can lower both daytime and nighttime blood pressure. It also improves heart function and decreases the risk of cardiovascular events. In patients with heart failure, which often accompanies chronic obstructive pulmonary disease, continuous positive airway pressure therapy can enhance left ventricular function and lower systolic blood pressure. Moreover, consistent use of continuous positive airway pressure therapy has been linked to a significant reduction in cardiovascular-related mortality. Some studies suggest that patients using continuous positive airway pressure therapy regularly may experience up to 55% lower risk of heart-related death. For those with both chronic obstructive pulmonary disease and sleep apnea, continuous positive airway pressure therapy can stabilize oxygen levels during sleep. This stabilization reduces the stress on the cardiovascular system caused by frequent drops in oxygen. By lessening this burden, continuous positive airway pressure therapy may slow the progression of chronic obstructive pulmonary disease. Additionally, continuous positive airway pressure therapy can improve insulin sensitivity and reduce systemic inflammation. These factors are connected to cardiovascular risk, especially in individuals with metabolic syndrome, which is common among those with sleep apnea. Practically speaking, managing sleep apnea through continuous positive airway pressure therapy leads to better respiratory symptoms, improved sleep quality, and increased energy. These benefits can enhance daily activities and reduce cardiovascular strain, potentially lowering the overall risk of cardiovascular disease in this vulnerable group. In summary, treating sleep apnea with continuous positive airway pressure therapy can significantly improve cardiovascular health for individuals with chronic obstructive pulmonary disease. By stabilizing oxygen levels, reducing blood pressure, and improving heart function, this treatment plays a vital role in managing the increased cardiovascular risks associated with these two conditions.